name is Orriols, and today I will be showing you how to take blood pressure. The first step you're going to want to do is make sure that your patient is calm, and now you're going to want to locate the brachial artery around their elbow. After you've located the brachial artery, make sure to slide the cuff into the patient's arm and make sure it is not too loose but not too tight. After the cuff is firmly placed, make sure that the valve is tightened and begin inflating. You're going to want to inflate to around 200 and begin slowly releasing the valve. As you're slowly releasing pressure, make sure to listen carefully for the first beat, which will be the systolic beat. Keep slowly releasing pressure until you hear the last beat, which is the diastolic beat. After you hear no more beats, release all pressure. Now make sure to remove the patient's cuff carefully from his arm. And you're going to want to put the systolic beat number over the diastolic beat number, and that is your blood pressure. My patient's blood pressure readings were 122/88. Now I'm going to be showing you how to perform CPR. The first thing you're going to want to do when you arrive at the scene is make sure that it is safe and check if the victim is conscious. Sir, are you okay? If he does not respond, you're going to want to check for the carotid pulse. After feeling for a carotid pulse and not finding one, my patient is unconscious, and so you will want to begin doing compressions and rescue breaths at a rate of 30/2. You are going to want to overlap one hand over the other and place them firmly on the chest and begin doing 30 compressions.
Now, something else that is really important when you're about to do CPR is to remember to do the head tilt chin lift technique. As shown in this picture, on the left we have the regular head position as if the head was positioned on the floor. Now to the right, we have the head tilt chin lift technique. And this technique opens up the air passageway, allowing for more air to be able to go into the victim's body. As I already said, this method is really important to remember because it allows for the victim's air passageways to open up and the CPR can be more effective. But now you need to be careful, because if you notice that your victim may have a neck or jaw injury, doing this technique may worsen the injury.
After giving 30 compressions, you're going to want to do 2 rescue breaths, but only do rescue breaths if you feel comfortable with the victim or if you have a pocket mask. As you continue doing compressions and rescue breaths, ask somebody to get an AED and somebody else to dial 911. Continue doing compressions and rescue breaths until AED arrives. Once AED arrives, use the AED and continue doing compressions and rescue breaths until an ambulance arrives to take the victim to the hospital. Thank you.
Now here's a brief description on what an AED exactly is. An AED, also known as an automated external defibrillator, is a portable device that automatically analyzes a victim's heart rhythm during cardiac arrest and determines if it's a shockable rhythm. A brief description on how to operate an AED is by first positioning and powering on the AED. Next, attach the AED pads accordingly. You're going to want to allow the AED first to analyze the heart rhythm, and if advised by the AED, deliver shock. Make sure to not place the pads on a pacemaker because that will ruin the shock. After the shock, immediately restart chest compressions and report rhythm analysis when prompted by AED. Also, it is important to remember that when using an AED, you must be very careful, and when the AED will deliver a shock, do not touch the patient because you may get shocked also. When placing the AED pads, it is important to know where they go. This picture shows that one of the AED pads should go to the right of the heart, and the other one should go around the bottom left of the heart in order to get a good shock.
Now we'll be showing you how to apply a tourniquet. Let's imagine that our victim has a laceration in his left forearm and he is bleeding out rapidly. You can use anything from a shirt to shoelaces to a belt as a tourniquet. It needs to be able to apply tight pressure on the above the victim's laceration. So we're going to use this shirt and we're going to wrap the shirt around the victim's arm tightly and firmly in order to cut all blood flow. Go. Now you should lift the victim's limb above his heart in order to reduce blood flow to the laceration. Tourniquets can be very painful and unpleasant for the victim and may lead to that body part having to be amputated, but it's better to lose a limb and be alive than die. Thank you for watching this video in which I went over how to perform CPR, how to take blood pressure, and how to apply a tourniquet.